Guess what is inside this pack? What is inside this pack is very important and very essential for your health. And it's something you can never do without, or you should never do without as a healthy human being, or someone who is sick, or someone who is in the hospital. Is something that that's required and needed in your life, day-to-day life existence and day-to-day life living. Now, let's unwrap what is inside this pack. Okay, hold on, hold on, hold on, hold on, hold on. One, two, go. Boom. Yes. Who can tell me the name of this thing? This is called sphygmomanometer. Now, what is sphygmomanometer and what is this thing used for? Sphygmomanometer is used for checking of blood pressure. Have you been to hospital before, or have you gone for checkup before? Blood pressure is one of the most essential things that must be carried out when you come to hospital for checkup. Like this, there are 4 things or 5 major things we check that will be the first thing to check to assess your health first before any other thing is done. Or after taking your names and your histories and every other thing, your address, the next thing is one of these, your hypertension, or what is commonly called BP. The 5 things that which we usually check are called vital signs in the hospital. Number one is your blood pressure. Number two, we check your pulse rate. Number three, we check your respiration. Number four, and then we also check for your temperature, and then some other things that may be carried out maybe after. So this is used to check your blood pressure. A lot of persons, millions of persons, thousands of persons are going around today with hypertension. They're going around today with BP without knowing that they have BP. They move around with all these things, with this issue, until it gets to a level where it can no longer be managed, it can no longer be controlled, or sometimes it may end up taking them. But it is important that you check for your blood pressure always, because we are living in a world where we have a lot of things that bothers us, a lot of things that bothers humans. You think of shelter, you think of feeding, you think of family, you think of your day-to-day activities. Your boss in the office trouble you, your neighbors trouble you, your husband trouble you, your wife trouble you, your kids trouble you. Lots of problems and lots of worries. And then all of these things sometimes compound your health, cause some things in our system that we are not aware of. But how do you get to prevent some of these things? Is by going to the hospital for routine checkup. Go and check for your blood pressure. Now, what are the causes of hypertension? Let's take a look at some of the causes of hypertension that we go about today with it without even knowing that we have these things. One of the causes of hypertension is obesity, overfeeding, overeating. You eat a lot. Sometimes obesity might not come as a result of um, maybe eating. It might be hereditary, but lifestyle influences it a lot. Lifestyle influences it. What you consume influences it. When you take too much calories that are above daily required consumption, sometimes it leads to this. And then when there is a genetic factor that will even provide a fertile ground for this, for obesity to come up, for fat to speed up, such persons need to avoid some diets, some foods that they eat every day. So when you observe that, you need to avoid some of those things. So number one is obesity. Obesity causes blood pressure. What it does is that it constricts the blood vessels, especially the arteries that takes blood to every other parts of the body. What I mean by constriction is that it narrows the blood vessels, it narrows the artery, and then that pressure of blood that is supposed to pass freely will now increase for it to be able to pass through that phase, or the amount of blood that is supposed to pass through that space of the artery. The pressure will now have to be increased, just like pumping water through a narrow pipe. The pressure will increase, but when you use a larger pipe, the pressure will reduce. That is what happens. That is what increases the pressure of the heart, or the pressure of the blood, in trying to force itself through that space of the artery. That is what is known as high blood pressure. Of course, the pressure is high. So I just mentioned obesity. And number two, we take sometimes too much salt in our food. Too much salt also causes high blood pressure. The heart does not like too much salt. Consumption of too much salt can lead to high blood pressure. Or if you've heard or you've come across someone who has high blood pressure complications, or most times the doctor's advice is that they should reduce the consumption of salt, or sometimes they eat food without even addition of salt in their meals. So salt is one of the cause. For this video not to be too long, also lack of exercise. When you don't engage in exercise, you're staying in one place, you come to the house, you're staying under AC, you go and sleep, you sit on your couch and watch television, you wake up in the morning, you jump into your car and you drive to your office. As you come down from the office, you get into your office and from the car, you get into your office and you sit down. You're always sitting down, you're always relaxed, you're not engaging in exercise that will at least exercise your muscles and your blood vessels and many other things. Exercise is one thing that we should not ignore. Very, very important. Lack of exercise also can cause blood pressure, and also stress. Stress. Too much stress, too much worry, anxiety. You overstress yourself. When you don't sleep well, when the time that your body is supposed to relax and then regenerate itself, renew itself, you're not resting. God that created time for us to rest, the night for us to rest, knows what he did, because he created the body and then he now created sleep. So it is very, very, very essential that we rest and then reduce stress that we engage during the day, and also avoid having sleepless night, avoid taking too much caffeine, sleep at least 8 hours in the night. And then another thing is smoking, lifestyle, smoking. People that smoke, when it is written there boldly that smokers are liable to die young, but yet they smoke, they take a lot of things. All of these things contribute to high blood pressure. And then excess alcohol. There are a lot of persons that take alcohol, they smoke. In fact, majority of the persons I've come across that smokes take alcohol. They are taking alcohol, they're smoking, they're taking alcohol, they're smoking. This one speed up high blood pressure. Sometimes you see them that when they come for a checkup, you see that their blood pressure is reading 180, 160, 150, 170, over 200. And these ones are red line. They are red line. So another thing is family history. I talked about hereditary family history. If someone is from a family that have had the history of high blood pressure, if it keeps coming back because it's hereditary, it's inherited. It's inherited. And then too much unhealthy diets. This one is common. Too much unhealthy diet. Some persons don't even cook in their house. They want to eat in eateries, those junks food. What they take in the morning, they take in the afternoon, they take in the evening. Most of these things contribute a lot to high blood pressure. Unhealthy diet is one of the things that causes a lot of these complications. Like if you observe that in the US, most persons have high blood pressure. Why? Because they eat unhealthy diet. Most of them are not ready to cook in their house. In the morning, they want to go to eateries and take something. In the evening, in the afternoon, they want to go to eateries to eat. In the evening, they want to go to eateries to eat. Some of these things, this food are not healthy. You don't even know how they prepare it. You don't know what is added to it. Some are written, some are not written. So all of these things are factors that contribute to high blood pressure. So what do you need to do? always go for checkup. And when they observe that it's discovered that you have high blood pressure, please engage in treatment and do not allow it to get to the chronic stage, to get to the stage that it can no longer be controlled or treated. It can be managed, it can be treated, and then you will regain your health and start living a healthy life and go about your day-to-day activities normally like every other human being. If this video have impacted you, please don't forget to like, share, and subscribe. I am Nurse Linus, and see you in my next video.